Good day. I am Annette Oltmans, founder and CEO of the Men Project. Welcome and thank you for joining in for this month's training intensive, Permission to Stop. When is couples therapy harming more than helping? And this is part 2. Before we begin, I want to let you know that we host training intensives every month through Zoom and Facebook Live. To stay informed, please subscribe to our website or follow us on social media and let us know the topics that you'd like to see us cover. We're always looking for new topics and within the realm of intimate partner violence or abuse or counseling or anything related to that. And we love hearing from you. So this training intensive today will be our last intensive this year. We'll be skipping December and picking back up in January. And I want to let you know that the Men Project is a nonprofit organization. I founded it in 2016 to educate, equip, and restore all those who are impacted by abuse. We teach victims, survivors, first responders, therapists, faith-based leaders, family and friend, and other organizations that are on the front lines about abuse, particularly in 2 categories. We train them how to understand and identify the complexities of psychological abuse. We try to simplify this complicated topic so that victim survivors can gain the necessary clarity to heal and to better advocate for themselves with their therapist, with their family, with their faith leader, and so forth. And we teach responders how to best interface with victims in order to prevent what we call double abuse. And double abuse is a secondary harm that often occurs when a victim reaches out for help, but is inadvertently or sometimes intentionally harmed because they are not believed, or they are criticized, or they are given incorrect instructions. Included in incorrect instructions comes misdirected therapy. And at times they're even wrongly judged or blamed for the abuse. And why we care so much about helping victims gain clarity is that clarity is the first necessary step that needs to occur before a victim can begin the healing process. Before clarity, they're confused. And so they need the language. They need to really understand the dynamics of what is happening. And then they can begin to feel empowered. And we care about double abuse. It's a very important topic to us at MEND because of how significantly it exacerbates a victim's trauma. That secondary layer of abuse, I'm sorry, I didn't turn off my phone. That secondary layer of abuse really is sometimes even more traumatizing than the original abuse. I am excited to speak to you about couples counseling. Earlier this year, we did a training intensive on couples therapy and why it's contraindicated if there is any form of abuse in the relationship. And you can find the videos from our past training intensives on our Facebook page. And I encourage you to take a look at that particular intensive because it's very comprehensive. And today I'm going to focus on the types of things that may alert you that couples therapy is counterproductive and possibly causing more harm than good. What are the red flags for therapists, pastors, or other first responders to notice? And more importantly, in this session, I want to talk about what the red flags are for you as a victim to pay attention to, or if you are the friend or family member of a victim who is feeling frustrated and not feel like they're getting help in couples counseling. Because couples counseling is really contraindicated. That means it's really ill-advised whenever there's any form, even a small percentage of abuse present. And I don't mean that abuse is small, but if it's not prolific, but if there's habitual patterns, then it really is contraindicated and it should be stopped. And the individuals would be better served by individual counseling. Couples therapy is an area where we see far too many victims of abuse experiencing additional unnecessary harm. We want to help you make better decisions about continuing in couples therapy and knowing when to stop. But I want to first tell you, after I take a sip of water, that full disclosure, I am not a psychologist. I am a survivor. I'm a content creator, and I've been conducting qualitative research for years by interviewing hundreds of victims, therapists, and faith-based leaders, as well as researching academic work regarding abuse and trauma. In my personal story, my psychologically abusive husband and I underwent years of couples therapy with a number of professionals, and none of them identified the abuse. And so what I'm talking about, not only do I know from my own story, but in my countless interviews with victims who experienced very similar things. And that is why experts in the field of abuse and trauma recognize that it is contraindicated or ill-advised. But many, many therapists, as well-meaning as they may be in their hearts, don't understand this protocol. And so they won't automatically disqualify themselves. They won't even be able to identify some of the signs. So let me move on. For the purpose of our time together, I'm going to refer to those who cause harm as abusers or the destructive partner, and those who have experienced harm, I'm going to refer to them as victims or survivors. And there will be a lot of helpful content that you may want to write down. So feel free to grab a piece of paper and pencil to take notes if you're interested. Okay, and speaking of notes, let me move down. The first thing that I want to make abundantly clear about couples therapy is that anyone has permission to stop couples therapy at any time. I think sometimes people feel like they can't go against their therapist's advice, but no therapist is perfect, and it's a very personal experience. So this talk is really aimed to empower you to be able to discern for yourself what is working and what isn't, and to feel confident to make the decisions that are best for you. So the therapist is hired to provide a service, and their service can come to a stop when you decide it's time to stop. Before you start therapy, I like to advise people that it's wise to shop for a therapist that is a safe expert trained in high conflict relationships and even abuse. If you realize that verbal, emotional, physical, any form of abuse is present, or if you've been in couples therapy and it's been unhelpful, there's signs that something is complicated about your relationship, something is toxic that's not being uncovered. And so I want you to consider that it may be abuse. Covert emotional abuse in particular is something that is very confusing, that a lot of therapists have not received training in their academic studies to be able to identify this. So even if you don't believe or you aren't sure that you're experiencing abuse, but feel that you are in this high conflict relationship, it's essential that you hire a therapist competent in identifying abuse and experienced in addressing it, because you will be depending on them to see everything that you are unable to see. And if they can't recognize abuse and they miss the cues that abuse is present, you will not be getting the help that you and your partner deserve. So go through an interview process, asking questions and doing a gut check to determine if you agree with their answers. And I believe we have a blog on our website where I talked about how to interview a therapist. And so you may want to take a look at that. Most therapists have a heart to want to help, but with that being said, they don't have the training. So it's important, they don't have the training. They haven't taken the time to take extracurricular or continuing education units in the topic of high conflict relationships or where emotional abuse is present. They receive very little training during their academic studies on abuse, only a few hours. And so it's really important that you adopt a mindset that you advocate for yourself. If they don't have significant extra training in these categories, you will not receive the support that you need. They won't even realize that they're not able to help you, but you will be caught in a cycle of being re-traumatized by their lack of alignment with you and their lack of support. And also, if the therapist gets defensive in response to your questions, this is a red flag to go elsewhere. Some therapists might answer your questions by saying something like, I've been working with couples for many years. I understand these topics very well. But if they say it in a condescending and defensive way, I would highly recommend that you leave that environment. That's usually indication that they aren't trained, because a highly trained person would be very compassionate and understand how triggering it would be to not be that way. There's no room for defensiveness. I've been, if they say, I've been working with couples for many years, or if they say, if they can't point to the extra education that they've actually embarked on their own, then you can assume that they are not going to be operating with best practices when it comes to a high conflict relationship. If you are being harmed in your relationship, you will be able to identify with many of these things that I want to talk about now. So let's say you experience trauma symptoms, such as, and you may not even understand that they're trauma symptoms, but uncontrollable shaking, or you may react really strongly, or you may retreat and shut down, or you may work extra hard to appease your partner. These fight, flight, freeze, and appease actions are involuntary. And sometimes you will, you'll find yourself that you blame yourself for certain things, or you take responsibility, or you look for how you might be responsible much more than your partner does. You try hard to understand your partner, and you can name some of the patterns where communication breaks down, but your partner won't be able to do that. And you are giving and you are empathetic, but your partner lacks empathy. You are less interested in managing your own image. So you don't care how you really appear so much, like as being right, but your partner really insists on winning arguments and holding an appearance and control. You believe in partnership and in a deeper emotional connection, but your partner fails when it comes to emotional intimacy. And you are willing to be authentic, but you don't sense a deep authenticity from your partner. And you are compassionate, but you don't experience as much compassion from your partner. You seek relational consistency so that there is not chaos, but your partner tends to be more chaotic. They're either more defensive, they are more avoidant, they do things that really hijack intimacy in the relationship. Relational integrity is important to you, but you don't feel that it's quite as high a priority to your partner. Maybe they make a lot of broken promises, or there's white lies and black lies that enter the scene more than what you would ever do. And you have the ability to describe the feelings of the one that's causing the harm. But that person you don't believe would be very accurate in describing your feelings. And you may have a hard time remembering harmful words, actions, or what exactly started the last argument. You may feel like you started an argument and then it went into the abyss, and you can't even recall what started the argument. That is a sign that you are in an abusive, a covert, emotionally abusive relationship. If this is you, there are a few things you are likely to be experiencing as you try, maybe for multiple times, to get a new therapist. You may be nervous about opening up but willing to try, wholly depending on the therapist to guide you well and to protect and defend you. If you have been in couples therapy before and it didn't go well, you might be more frustrated and eager for the therapist to identify the problems that your partner is displaying. In this case, you may have run out of patience because you feel that prior therapy was so unhelpful, you're so weary and exhausted, and you don't really have a lot of confidence in therapy. If you are wrongly judged for your impatience by the therapist, you need to find another therapist. It is perfectly appropriate for you to be out of patience and for you to convey that accurately to the therapist and say, I don't feel that the prior therapist was identifying the problems. They weren't identifying the patterns, and we didn't get anywhere. And I'm frustrated. I don't have a lot of confidence in therapy. It's perfectly appropriate to say that and to not be labeled back as too frustrated or too angry or too impatient or bitter, all those things that are wrongly labels placed on the person who's receiving the harm. More than likely, when you reach out for help from a therapist, your mental and emotional state is fragile. It's easily traumatized. And you have already worked so hard to resolve and find solutions to the problems you are facing in your relationship, only to have to come up against dead ends. Your physical state may be fragile because of ongoing stress and traumatic states of stressful confusion. And you may not even have identified that your physical state is related to the relational stress that you're going through, but this is very common. You may be experiencing the silent treatment from your partner, or your partner may avoid authentic communication and the work it takes to resolve issues in a mutually beneficial and empathic way. You may be able to identify that when you express your emotions, your partner judges you rather than presents to you a sense of curiosity to want to understand more about what you're saying. That would be a healthy response, curiosity. Judgment is a sign that emotional abuse is present. The bottom line is you are seeking out a therapist who would be able to identify what is going on and be able to unravel the complicated, confusing, and even painful nature of your relationship. And you both need and deserve to have, to find someone who can to provide you with a safe therapeutic setting. It may be quite a journey getting to a therapist who is helpful for you, but there are many signs that couples therapy is causing more harm than helping, but I will go through a few of those. I want you just to be patient, be willing to shop for a therapist, and to be willing to exit when you don't feel that it's going well. There are good therapists out there, and so your goal is to find one, particularly one that will help you on an individual basis. And we'll talk more about how that can actually help the couple. So if you find you're having to defend yourself in therapy, that's a sure sign that it's not a safe place for you. I want to give you one example. I remember shopping for a therapist, and I knew that I was experiencing post-traumatic stress disorder. And I said, are you experienced in complex post-traumatic stress? Have you taken extra classes? And he said, oh no, I'm very experienced in complex post-traumatic stress. So I started to describe a little bit about what I've been going through. And one of the first things he said to me is, why did you stay so long? Now, that is obviously not a question that you ask a victim who's just starting to disclose abuse. That puts the victim on the defensive, like something was wrong with me for staying too long. And I knew right away, just that one answer, he doesn't understand the triggers of somebody who's so traumatized. And he clearly doesn't have the experience. If you're in couples therapy, a common ploy the abuser uses is to create a cloud of confusion, or this is so important, I want you to remember this, or invent false accusations to derail the conversation from having to focus on the abuser's own behavior. And you might think, no, my partner's not going to lie to me in therapy. You may not even recognize it as a lie. You may just think, or a false accusation, it's the same thing, but you may think, they just don't remember it the way I remembered it. But I want you to really be in tune that false accusations are a common ploy to take the focus off the abuser and to place the victim on the defensive. Because when there's a false accusation, then suddenly the victim has to explain themselves, and it may take 20 minutes to explain why this thing isn't exactly correct. They may use a shred of truth covered in distortion of history, and you have to explain yourself. And this is just a waste of time, and it keeps the focus off of the abuser. And so just be aware of that. And a skilled therapist would be able to identify that. But if they are not able to identify that, then I would highly recommend that you find somebody else. If you find that you open up vulnerably about your thoughts and feelings during therapy, and when you get home, your partner uses the things you shared during therapy against you, this is a sure sign that couples therapy is not a safe place for you, and you are likely to be in an abusive dynamic. For example, say your partner makes fun of the emotions that you shared during therapy when you get home, making it seem as though you were lying or making up emotions or over dramatic. That is definitely a sign to not be in couples therapy. Your partner's not safe. Or maybe they make a sarcastic joke in front of others in public that divulges the confidences that you shared during therapy. Or maybe they give you the silent treatment or express anger about the things that you shared. These are all strong signals that you should not be in couples therapy at this time. If you find yourself in this situation, ask your therapist to meet with you one-on-one to discuss what you are experiencing at home post-therapy. This may be an important opportunity for the therapist to defend you and to hold your partner accountable within the therapeutic setting before you stop. Or you may say, I don't want to do this in front of my partner. I'm going to communicate this privately over the phone or in my own session. The therapist may be able to help communicate the reasons couples therapy isn't working and make strong recommendations for referrals or individual therapy. And so that's something you might want to consider tapping into, but you'll have to just discern for yourself what you think is the most safe. If you are upset or frustrated, a good therapist will validate those feelings rather than follow the path of the abuser into never land of minutia, because there's never an end. It just goes on. The abuser will just keep falsely accusing or diverting, deflecting, doing all kinds of things to stonewall authentic communication. Or if the abuser is focusing on their own feelings rather than addressing the behaviors and the faulty thinking that supports and drives the behaviors, it's going to be a traumatizing experience. Let me say this another way. If the abuser is talking about their feelings, but they are behaving harshly towards you, or if the therapist is focusing on the abuser's feelings rather than confronting the faulty beliefs and thinking that drive those destructive behaviors, then couples therapy is strongly not recommended, because destructive people need to have their faulty beliefs, their faulty worldviews, their, for example, feelings of patriarchy or feelings of entitlement or beliefs that they are entitled to a different treatment than you are entitled. Those things need to be unpacked, and it takes time, and that's for individual therapy. And it would be really harmful to sit there as a victim who's experienced destructive behaviors the entire week prior to going into couples therapy, and now the therapist is focusing on the abuser's feelings. That would feel very violating, and it's not appropriate. the therapist can easily get caught up in the minutia instead of recognizing the patterns of behaviors. However, a therapist that's specially trained in addressing abuse should be able to recognize the tactic, the behavior or the behavioral pattern, and stop it in its tracks at a minimum. They should confront those patterns and say that they will not be allowed in the therapeutic session. If you are the person who is not receiving empathy from your spouse on a regular basis, and the therapist is focusing on the abuser's feelings rather than how a lack of empathy is destructive to a relationship, and without empathy, you can basically not have a relationship. If the therapist is not fully supporting you, you should stop therapy. This is an indicator that couples therapy is going to just be highly traumatic and a waste of time. Another sign that couples therapy needs to stop is when the therapist assigns, say, 80% of the responsibility to the destructive partner and 20% on the one being harmed. If you are seeing a therapist who assigns any portion of the responsibility to you, this is a strong indicator that couples therapy will cause more harm, and you absolutely have permission to stop. When any form of abuse or any amount of abuse is present, the emotionally abusive behaviors or tactics need to be the only topic that is dealt with, and the faulty beliefs that make the abuser feel entitled to behave this way. At no point should any responsibility be laid at the one who's being harmed. Until abuse is confronted, the abuser owns it and is making reparations commensurate to the harm done. I mean, real tangible evidence that they are taking responsibility. If that is happening, then couples therapy would be okay. However, if that's not happening, it's too soon for couples therapy. Finally, far too often victims share with us that their couples therapist will separately acknowledge to them outside of the abuser's presence that their partner may be a narcissist or maybe borderline personality or some other diagnosis. And while this might validate the victim somewhat, when the therapist communicates they're unwilling to address these suspicions that the therapist has about the abuser with the abuser due to their concern that the abuser might walk away from therapy, then the victim is left stranded alone without a lifeline. This is never an okay way for the therapist to communicate with the victim of abuse. First, it puts the burden of the abuse on the victim without holding the abuser accountable for their behaviors and not identifying, narcissistic tendencies or whatever the problem may be, so that it usually comes from a fear that the abuser is going to leave. They're going to leave therapy. And that is something that an abuser needs to be able to choose to leave. It's not good to keep somebody in a therapeutic setting when there's not full alignment with the victim. Okay, so let me just glance at my notes because I wanted to. One second, I'm sorry. Okay. I strongly encourage ongoing individual therapy for the victim. The benefit of individual therapy for the victim is significant. And I know that it might seem like, well, then I'm abandoning the hopes that I have that therapy is going to help the relationship. But if therapy isn't working, then it's important to step out of that because it really is harming yourself emotionally and physiologically. It's adding too much stress. And there's a lot you can gain from individual therapy that can also help the relationship and help your perspective on the relationship. The benefit for individual therapy is that the therapist will be able to fully align with the victim, focus on their traumatic symptoms, clarify ways their voice has been minimized in the past, and build up a sense of self-worth and address codependency and overfunctioning. This process of validation and encouragement will often lead to gradually preparing the victim to fully gain their voice, reduce traumatic symptoms, teach them to set and hold firm boundaries, and stand with them in the case that the victim will need to follow through with consequences when boundaries are broken and not immediately repaired. And if the abuser is desiring and committed to the process of his or her own healing towards change, individual therapy with a highly skilled abuse therapy is recommended, along with a batterer's intervention program. So those are points that I hope that you will take away. I'm skipping one thing I want to focus on. When the therapist, I want to talk about alignment. With therapists attempting to provide a safe space for both people in couples therapy, this happens often in couples therapy because technically their board requires a therapist to be neutral, but there's no neutrality in abuse. So it's a mistake. And so when a therapist is aligning with both parties, then the victim is actually feeling abandoned anytime the therapist is aligning with the abuser. It's just not appropriate. When there's any form of abuse or really destructive behaviors happening in the relationship, it's absolutely essential that the therapist aligns fully with the victim. Often therapists will focus much of their attention on getting the abuser to engage in the process, exploring his or her feelings while ignoring the victim's need to identify and confront destructive patterns of behavior. From the victim's perspective, the therapist's extra effort and attention on their abusive partner puts the therapist in alignment with the abuser, making the victim feel abandoned and unheard, creating an unsafe atmosphere for the victim. It is really unhealthy. And you might think, without being actually involved in the experience right now as I describe it, oh, that's not such a big deal. But when you are upset about something and you're really emphasizing and you're wanting to be understood, and then the therapist just ignores where you are and aligns with the one who's being destructive, it is traumatizing. It is misdirected therapy. It is wrong, and it's traumatizing. It's not good for you. So the likely unintended result exacerbates the victim's trauma. It's a form of double abuse rather than receiving the help and unwavering validation that the victim desperately needs and deserves. And rather than focusing on the abuser's feelings, like I said, I want to emphasize again, it's the faulty thinking, the faulty beliefs, and that they feel entitled to special treatment. That needs to be confronted and unpacked, and that takes a long time. Let's see here. Okay, along the same line of couples of aligning with both parties, therapists that I've interviewed have often said, and I find this just an example of the lack of extra training that they have had. They'll say, I'm not hired to confront. And they believe that, and that is appropriate probably in a healthy couple's relationship therapeutic encounter. But when abuse is present or destructive behaviors are present, those need to be confronted. So it's not following the kind of correct protocol that normally would take place with an expert abuse counselor. In the incorrect counseling session, they often tiptoe around labels, and they tiptoe around these behaviors that need to be confronted. And the victim cannot climb their way out without precise clarity of the problems. And the abuser will never gain clarity if they are not confronted. As I mentioned before, clarity is the first step to healing. And the victim needs the therapist to label the abuse and set firm boundaries, help the victim set boundaries against its tactics, where both parties mutually agree, this is the boundary when you do that. And then the therapist can see, well, how does the destructive partner respond to that boundary the next time it occurs? And again, though, I have to say couples therapy is contraindicated, but if you aren't sure that what you're experiencing is emotional abuse or psychological abuse, you may be in couples therapy. And so these are just ways to help you decide whether it's time to stop. Oftentimes I've heard the therapist say, well, who's going to help the abuser? He or she will walk away from therapy if I confront behaviors. And I want to say to you that the best thing that can happen is that the destructive partner is confronted, and that they do walk away from therapy if they can't take being confronted. Or better yet, that the therapist says, based on the way that you are behaving, you're not, it's not appropriate that you two are in couples therapy. Your behaviors are traumatizing, they're harmful, and as long as you are in a place where you're harming your partner, it's better for you to be with a separate therapist, because I can't properly support your spouse while you are in the process of harming them, even in this therapeutic environment. And so then the abuser will get the sense that they are being held responsible, that they need to go elsewhere, and hopefully the therapist has a good referral for them. But by doing so, the abuser experiences what many experts say, that they need to experience a breakdown before they can experience a breakthrough. They need to be confronted. They need to experience consequences for their behaviors, because until that, they are in total denial. They're in control. They are driving the relationship, and nobody has stepped in and intervened and said, this is destructive behavior. And so in most cases, the kind of breakdown that an abuser needs is a separation from the marriage. If this is a marital relationship, they need to actually experience that kind of a firm boundary from their spouse, because without following through on ultimatums and boundaries, the one who is being destructive just continues the behaviors. There's no motivation to change. They haven't experienced the breakdown, the pain of a loss, before they then are motivated to pursue a breakthrough, which is the very hard work of change. And it is very hard work. It takes an abuser who's truly entrenched in faulty beliefs and thinking. It takes about 2 years of intense therapy to change. And let me just give you an example. And I like to use politics as a metaphor. If somebody was a far left Democrat and they were told that they need to change their beliefs to be a far, this is my right, your left, I'm doing it backwards, I'm right, Republican, or vice versa. It's a long distance emotionally to travel, intellectually and emotionally to travel, to completely change one's worldviews. And that is what an abuser needs to do, because their faulty thinking is so embedded, it's so entrenched, and they don't realize that they're looking at the world and they're looking at relationships through a false lens. And oftentimes the one on the receiving end, the victim, doesn't realize that they're interfacing with a partner who has an entirely different worldview about relationships. And that's why the victim tries so hard to find ways to communicate and connect with their partner. And it's unfulfilling. It doesn't reap any rewards, because they aren't healthy. They don't have the capacity they are controlling, they are manipulative, they are defensive. And it might stem from early trauma. I'm not saying that there couldn't be old wounds, but old wounds do not justify causing current harm. And so the victim needs to be protected from re-traumatization, and the abuser needs to be confronted. And so that's basically what I have for us today. If you have any questions, I would love to hear them, and I would love for you to reach out and give us ideas for our, let us know what you would love to hear us talk about. We always love to hear from you.
All right, we do have some questions in these last few minutes. First question. I have had this issue happen myself when my husband mocked me for things I said during therapy, and I kept going back. Thank you so much for sharing this. I'm wondering if you have any advice for how I can respond when my husband does this.
Okay, assuming, now this is, I don't know the diagnosis of your husband. I don't know if he's just adopting a bad habit and not being considerate, not really thinking thoughtfully about it, not having a sense of curiosity. He may be really defensive and abusive. I don't know, but a healthy person, I would say, you know, counseling is supposed to be a safe space for both of us. And that's where we're trying to seek help. We're trying to get underneath the issues and really shine light on them. And so when you mock me, you are interfering with my authenticity, my true attempts to shine light on the issues that I hope to help us. And I would just stay connected, but confront that as saying, I want you to stop doing that. I'm going to bring it up in therapy, and I want to understand why you think it's important to put me down for authentic communication. I think that's what I would say.
Okay.
And you will gain clues based on the response that you receive. If the person says, you're right, I shouldn't be doing that. Oh my gosh, I'm sorry. Then you're likely not dealing with an abusive mindset. But if they go into more mockery and sarcasm and fighting, and oh yeah, you're going to tell the therapist, you know, being sarcastic, defensive in that way, then that is a strong signal that you are dealing with a destructive person that you're not going to get very far with in couples therapy.
Another question that we had. If I leave couples therapy, my wife will tell me I'm not trying or that I've given up on the marriage. I really don't want to give up on the marriage. Leaving couples therapy is a very hard decision to make, and it goes against all the advice others in our circle have given us. My men's group at church has very strongly encouraged me to keep at it. I'm concerned I'll lose their support. How do I do this well with my wife and my small group?
Well, that is I really understand the difficulty of that. And I remember going through that myself. I made the decision to stop couples therapy before I understood that it was really contraindicated in many circumstances, but I just intuitively saw that it was just wearing me down and not producing any results. It was just chaotic. And so I just, you know, you are not always going to have the support of people around you. This is a hard reality that we all have to face. I don't know if your spouse is being abusive or if you just need to find a better therapist. But I would first try to make that determination. You can go to our website and you can look up our terms and definitions for covert emotionally abusive behavior. And if you see patterns in that list of behaviors, then that will give you one clue as to why couples therapy might not be working. But if you have a healthy spouse and you just have some communication problems or some old trauma and things that you need to work through, then it may be that you need a trauma specialist, somebody who's more highly trained. And in terms of dealing with your small group, people are adults and they aren't supposed to judge, but they will judge. And I remember experiencing that myself. It was very disruptive and harmful. And I didn't have a strong enough sense of self-worth and confidence to be able to manage how that was affecting me. It was devastating to me. But you just need to be resilient and be strong and make an informed decision, do your research, make an informed decision, and be confident in your delivery. And if people do not support you, then you may need to find another group of people who will, because it's not healthy to be around people who are inserting their opinion on your intimate relationship and judging you. It's not helpful. I hope that makes sense.
Yeah. Here's another question we got in. I'm in couples therapy, and it seems that my therapist is really supportive of my perspective most of the time. But there are times when my spouse is confronted about certain behaviors, such as lying, when he tends to get extremely angry, the therapist backs down. When we go home after those sessions, he feels validated and the cycle of abusive actions repeats itself because the therapist was supporting his view, quote unquote. How do I get our therapist to realize that when she backs down, we're restarting the process over and over again? Should I be counseling separately now or find another therapist for couples therapy?
Mm-hmm. Well, lying, when your husband lies, I think you said you're a female and it's your husband. Mm-hmm. Lying is a covert emotionally abusive behavior, and it's highly destructive. Any one covert emotionally abusive behavior repeated in a pattern is enough to be destructive to a relationship. And so if you've identified lying and maybe like you're also identifying that he gets really angry in therapy, those are two things that are destructive to the relationship. That doesn't work. And so I personally would not engage in couples therapy, but I would talk to the therapist alone and say, I want you to address the fact that you have backed down when my husband gets angry when you confront him on lying. And I want you to do that in the presence of both of us and own that that's been a mistake, because that has actually emboldened his abusive mindset and has put me in more emotional stress and harm's way. And I want you to own that. And I want you to say that couples therapy, because of his behavior, is contraindicated and that you need to find individual therapists. That is what I would do. I would not continue on with someone who is lying because it is so destructive, and someone who won't be confronted. That is very typical of an abusive mindset. They say and do anything to avoid responsibility and avoid accountability. And so that outburst of anger and defensive,ness, shutting the therapist down, is an example of that. So those are two really strong signals that you're dealing with someone who has probably a lot more destructive behaviors, and you have not yet identified them yet. So that's what I would not put myself through the stress of being in couples therapy with someone who has a pattern of lying.
So we have a question on finding a therapist. What are the best ways to find a therapist who is competent in addressing abuse? Are there networks or websites you can refer us to, or is there another process that we should follow?
If you want to contact the MEND Project, we do have a referral base of therapists that we refer to. And so that's what I would recommend, because there's not a lot of therapists. If you're a woman, we have referrals, but you could do private coaching with Leslie Vernick. She's written a couple of books about verbally destructive marriage and relationships. But we do have a referral source that we could try to connect you with as well. There's not, as far as I know, there is not a website that shows a list of referrals of people who have had this training. There should be, but I'm not aware of anything like that. In fact, it's sad that so many therapists are not trained in this. And so it is difficult at times. And that's why I'm protective. I like to refer people that I've vetted and that I know really understand this topic.
So I think we have time for one or two more. I'm a victim of abuse that has been in couples therapy for the last several months, but I feel like therapy has made it 1,000 times worse. How do I safely remove myself from this situation? Is there a way to get the therapist to believe my side of the story? I'm worried that this will cause a retaliation, backlash, or more problems.
Well, anytime you set a boundary, it's very possible that there's going to be a backlash and retaliation. And it's unfortunate, but when we set boundaries, when we're in an abusive situation, you almost have to really put on a tough skin and prepare yourself for what comes to follow. It's like there's a heightened area of trauma to follow, but it does dissipate over time, unless it's a dangerous situation, in which case, until you completely remove yourself from the relationship, at least on a temporary basis, and do a marital separation, you are going to continue to receive retaliation the stronger you become. And so there's another tack you could take, which is to emotionally detach from your partner and just be parallel partners in the household that don't interface very much. It's not a very fulfilling or rewarding way to live, and you're walking on eggshells. But if you're not able to leave and therapy isn't helping, and you have identified abuse, I would just seriously caution you to consider a separation so that your spouse can experience that breakdown, that actual ultimatum that was followed through, the boundary that was followed through on, and where you're taken seriously. If you're in couples therapy and it's getting worse, it's awkward, but I would have a private session with the therapist, and I would confront the fact that I would download our terms and definitions on our website so that you go in there with tangible tools, or take your computer in and open it up to our website. And sometimes when a therapist sees something in writing from a legitimate organization, it's a way for you to advocate for yourself and to politely confront that they are not identifying these behaviors as being abusive. And right on our sheet, it says covert emotionally abusive behaviors, and then the terms and definitions. So it will actually validate your position. And then you can say, whenever any form of abuse is present, it is my understanding that couples therapy is contraindicated. It's not advised. And I'm wondering why you haven't disqualified us from couples therapy, and just confront the situation. And I would do that, most likely I would do that alone. And I would say that I need to be fully aligned with, I am not the destructive partner, and I'm not getting that support. And these patterns are not being identified and confronted. And I would like you to say that you've identified these patterns and terminate couples therapy. based on those reasons. So it's not that you're stepping out of it. And if the therapist doesn't do that, then you just have to put your big girl or big boy pants on and just make the decision for yourself. And you can bring in our list of definitions and tools and circle the patterns that you experience happening most readily and what is happening in therapy. And you can, or you could bring in our website, but the spouse, your destructive spouse, will most likely just mock our website and not deem it credible, even though the therapist is more likely to take note that they are out of their realm of expertise.
All right. Well, I think that's all we have for today.
Okay. Thank you so much for being with us, and we'll see you back for an intensive in January. Take good care and happy holidays.